Hello everyone and welcome to a new session of clinical pharmacology drug therapy. In this session we are going to review some questions in dermatology. The first part of the review question, we are going to review acne vulgaris. Okay, the question here, which is considered the first line topical agent for managing mild to moderate acne vulgaris? So here we ask about first line topical agent for acne vulgaris. Okay, clindamycin, dapsone, benzoyl peroxide, or isotretinoin. If you review the slide and in our presentation, you can see here the first line therapy for mild, first line therapy for the mild moderate acne will be benzoyl peroxide. So if you look what we have here, clindamycin, then we have dapsone, isotretinoin, benzoyl peroxide. So the correct answer will be benzoyl peroxide. Moving to the next question. What is the mechanism of action of benzoyl peroxide in acne treatment? Select all that apply. So we ask about the mechanism of action of benzoyl peroxide. Is the benzoyl peroxide present anti-inflammatory activity, comedolatic and bactericide effect against the Propionibacterium acne? Is the benzoyl peroxide has an anti-androgenic activity or inhibit keratinocyte proliferation? So the benzoyl peroxide mechanism of action, refer you to the slide. And with the mechanism of action here, and we can read it like here, we have bactericidal effect, comedolatic effect, suppress the sebum. Okay, you can see here we have anti-inflammatory effect, comedolatic effect, inhibit keratinocytes, and in this case we have three correct answer. We have anti-inflammatory, comedolatic, and inhibit keratinocytes. Moving to the next question. Which topical retinoid is approved for acne treatment in patient aged 6 years and older? Tretonion, tripharotene, adabalene, tazarotene. I will maybe bring some slide to verification here. You can see here tripharotene, considered like fourth generation retinoid, and this could be prescribed for the patient aged 9 years and older. Okay, so the correct answer will be tripharotene. So which topical retinoid is approved for acne treatment in patient aged 9 years and also older will be tripharotene. Okay, next question. Which oral medication for acne vulgaris treatment require 2 forms of contraception in females of childbearing potential due to the teratogenicity? Spironolactone, oral antibiotic, isotretinoin, or cyproterone acetate? Okay, if you review the slide here, for black box warning for isotretinoin, you can see here we need to provide maybe protection for pregnancy here. So the isotretinoin will be the correct answer. So we need to provide methods for contraception due to the risk of teratogenicity. Okay, next question. Which of the following is third generation retinoid? Select all that apply. Tripharotene, tretonion, adabalene, tazarotene, isotretinoin. If you look what we have here, we have first, second, and third generation, then we have fourth generation. So which of the following apply? Okay, as you can see here, third generation, we have adabalene and tazarotene. So the third generation, adabalene and tazarotene. Next question. Which laboratory tests are necessary before starting isotretinoin treatment? Liver function, lipid profile, pregnancy test. A. B. Complete blood count, urinalysis, pregnancy test. C, serum creatinine, liver function, fasting glucose. Or D, serum electrolyte, fasting lipid, complete blood count. Comparing with our data, our maybe information on the slide, necessary lab test, liver function, pregnancy test, lipid. So the correct answer will be liver function, lipid profile, pregnancy test. The correct answer will be A. Okay, move to the next question. What is the black box warning associated with the isotretinoin? Hepatotoxicity, suicidal ideation, and progress and aggressive behavior, severe photosensitivity, or teratogenicity. Okay, according to the link here from the FDA drug facts, the correct answer will be teratogenicity. Okay, I will share the website regarding the isotretinoin. And the isotretinoin, the brand name Accutane. Don't use it, don't get pregnant. It's very important. We have the eye pledge for that. And you can see here the contraindication black box warning. Accutane must not be used by female patients who are or may become pregnant. Okay, next question. Which systemic antibiotic are preferred for moderate to severe inflammatory acne vulgaris? Okay, so here we're talking about the case of acne. It's like moderate to severe acne vulgaris. Then we ask about systemic antibiotic. So we're looking for systemic antibiotic for acne vulgaris. Medication for systemic oral. We have clindamycin, erythromycin. We have doxycycline and monocycline, azithromycin, ciprofloxacin, trimethoprim, and civalixin. Okay, comparing to our lecture, our slide, antibiotic, we use for the oral, for systemic, monocycline, doxycycline, and erythromycin. So the correct answer will be, okay, the most popular medication, systemic antibiotic for moderate to severe inflammatory acne vulgaris, doxycycline, and minocycline. Okay, which topical agent, next question, which topical agent is most appropriate for patient with sensitivity to conventional anti-acne agent? So the patient does not respond to the traditional treatment, benzoyl peroxide, Dapson, salicylic acid, or adabaline. Okay, moving to our lecture, you can see here Dapson, Axone. Dapson is like useful for patients with sensitivity or intolerance to the conventional anti-acne agent. So the correct answer for this question will be Dapson. Next question. What are the goals of acne therapy? Select all that apply. Lower sebum production, increase keratinization, prevention bacterial growth, or decrease inflammation. Okay, goals of acne therapy. As you can see here from the slide, goals of acne therapy is lower sebum production, lower hyperkeratin, prevent bacterial and decrease inflammation. So select all that apply, A, C, and D. Lower sebum production, prevent bacterial and decrease inflammation. If you look on number B, the correct statement should be decrease keratinization. Okay, which of the following, what is the mechanism of action of azelaic acid and the acne treatment? Select all that apply. How the azelaic acid work as an anti-acne medication? Anti-inflammatory and chemolytic activity, bactericidal effect against Propionibacterium acne, anti-androgenic effect, keratolytic effect at high concentration. Azelaic acid. So as you can see here from the slide, azelaic acid work for mild to moderate. First of all, present antibacterial, present anti-inflammatory, inhibit keratinocytes, and present maybe or has a chemodulatic activity. So the correct answer will be, you can see it here, affect the inflammation, affect the bacteria, affect keratinocyte, but there is no effect on the anti-androgenic properties. Okay, this will conclude our review question regarding the acne vulgaris.